But it's not just something celebrities have. Normal people can be sex addicts too. And joining us now is sex therapist Dr. Morgan Francis. Thank you for being here.
Thank you so much for having me.
Good morning to you.
Good morning.
So sex addiction is real, because we were joking about it in the meeting, like, oh, come on, aren't we all kind of sex addicts? But you're saying no.
Correct, it is real. So it's an intimacy disorder. And what manifests it is the compulsive sexual thoughts and also the compulsive sexual behaviors. And these sexual thoughts and sexual behaviors really negatively affect the individual and their family members.
Because then it brings up the whole question of what is healthy, then a healthy appetite, and you mentioned it had something to do with intimacy.
Correct. So sexual health or having a sexual healthy relationship includes emotional intimacy and connection, and really being able to be with your partner and having the trust and the open honesty.
Is it not okay to have, I mean, if you're a younger person, have, you know, the hookups like the kids are doing now? It seems like now you can swipe on your phone, let's hook up, let's not hook up, let's
On
do all
those
that stuff.
apps, they got apps for it.
Yeah, right. So can you go through it? I mean, what's healthy and what isn't?
Well, that's a really good question. So, you know, when a person's not in a relationship or a younger individual, sure, they're going to have those, you know, advances to be able to be on the apps and look for hookups. However, when it starts to have a negative adverse effect, meaning that it's affecting your personal life, you start feeling depression, you start acting out maybe with substances, and also it may affect their academic or school and employment. So you got to make sure that it's not affecting the personal life and having those negative adverse consequences.
And so how is something like this treated when patients come to you?
It's really important that a person works with someone who specializes in sexual addiction treatment. Where I work at my private practice is psychological counseling services, and we really specialize in the treatment and the individualized care. So a person can come and participate in the intensive outpatient program, and that leads 50 hours of therapy in 1 week. So it's really helpful because for individuals, like you mentioned earlier, they don't have the time to go to some place for 30, 45, 60 days. So this really helps to have everything done in 1 week and individualized care of 30 hours of individual therapy.
So take me through it. I mean, what do you say to them? I know you can't go through 50 hours of treatment. Is it basically like what's going on with you? Where's the hole in your life or something like that?
Absolutely. We really take our time looking at what's the primary problem, and a lot of it always goes back to trauma. So in their childhood, there are events that have been compounded that have affected the way that they're able to cope, the way that they think and feel, and it really has negatively affected their brain, their emotion regulation, and so because of that, they don't have the skills like normal people do,
and therefore reach out to try to make them feel better, themselves feel better by
and sex feels
having
good.
Sex.
Right.
Absolutely.
In terms of recovery, when you have someone who comes to you, what is the rate of recovery? Like, are there chances that they go back to it, and how likely is it that they won't?
There can be always chances for relapse, and so that's why we work with relapse prevention. How our intensive outpatient program works is that the clinician or their current therapist refers them to us, and then we refer them back to their ongoing therapist because we just see them for a week to 2 weeks.
So if people think that they may have this issue, you're saying you should probably see somebody?
Absolutely, you should see somebody and get the help and know that you're not alone. And it's really great that someone like Ozzy Osbourne's coming out publicly to talk about it, because then it lets other people know that they're not alone and that they're not the only one struggling.
I thought they'd be together forever, Ozzy and Sharon. They seemed like a pretty cool couple.
They were together a long time.
Yeah. All right.
All
Dr.
right.
Francis, thank you so much
Thank you
for
so
being
much.
here.
It's good to
talking
see you
with
again.